So the new edition of the ASAM Criteria is going to be released in October of 2013. This new edition has a number of new sections, new information, especially responding to field comments that how do we apply the ASAM criteria with our population and our setting. So new sections on working with people in criminal justice settings, working with older adults, working with parents with children, and then a special section on people in safety-sensitive occupations like pilots and physicians and nurses. There are emerging understandings of addiction with 2 new sections on tobacco use disorder and gambling disorder. We have changed terminology in the name itself. It's called the ASAM criteria now, not patient placement criteria, not because placement isn't important, but it goes way beyond just placement. In this edition, we're really encouraging an understanding of using the criteria in assessment, service planning, and ongoing treatment throughout a continuum of care in a chronic disease model. Well, one key concept in this edition of the ASAM criteria is using ASAM's definition of addiction, the pathological pursuit of reward or relief by using substances, but not just substances, by gambling behaviors and addictive behaviors. We've included that in this edition, especially with new sections on gambling disorder. We've looked also more closely at what is the role of physicians. We've had always information about what the role of physician is in each level of care, but in this edition we've tried to define that more clearly about what is the role of the addiction medicine specialist, the addiction specialist physician, or the addiction psychiatrist. In this edition we have spelled that out a little more clearly for each level of care as well. The ASAM Criteria book or manual provides the foundation for the whole treatment flow. The enhanced web-based version is a version that gives you the full text of the book, but also some exciting numerous interactive features that will help support your application of the criteria in your everyday work. And then there will also be the ASAM Criteria software that provides a level of care recommendation for the adult criteria. In the current environment of healthcare reform, the ASAM Criteria, this new edition, adds to its mission of increasing access to care and efficient use of resources. There is new information on screening and brief intervention and referral and treatment, and integrating addiction services across healthcare and in mental health to reach the needs of all people with addiction.